Hey, everybody. We're so excited to have you today. It is my pleasure to have myself, Kristin, and Marina all together in one kind of roof here. And it's going to be a lot of fun. We're going to do kind of a crossover episode today. So if you are in one specialty of pharmacy or another specialty of pharmacy, there's a lot we can learn from each other and a lot we can do together. So we're going to explore that today in Lab Services Meets Herbalism. Talk to you soon. Well, hello, like two of my favorite people in one room. That's so wonderful. I wish it could be a real room. We'd actually get to see each other would be even better. But Kristin, how are you doing this morning? Life good?
I'm great. Absolutely. Thank you for asking. I'm excited to be here and talk to Marina a little bit.
Oh, yeah. And Marina, how's the family doing?
Yeah, likewise. I was just at my son's recital from pre-K daycare, and they did like a Mother's Day show edition a few days late, but it was so sweet.
Oh, man, that's so wonderful. I got the pleasure of helping my mom and dad move over the weekend. And I feel like that was a clashing of multiple worlds in one way, but we got stuff done, you know. But your guys' clashing of worlds that I wanted to kind of talk about today was with lab services and herbalism. When we approach the two, you know, Kristin, I know your background is functional medicine kind of components and lab services. So any things, I guess, in there to educate us on oftentimes you're going to see a patient coming in and this is how you're doing some overlaps in those two spaces, in the functional medicine and lab services spaces.
Yeah, definitely. So that kind of goes back to some of the different things we've talked about. I use a lot of hormone panels, stool tests, food sensitivity panels, and some more complex testing to really see what's going on internally. And that testing isn't being done by your conventional practitioners. So there's a lot that you can do with just supplements and lifestyle changes without prescription medication to actually help people feel better, not only immediately, but then put them on a healthier path. And so I definitely think that herbalism plays a huge role in all of that too. Like you can do some of the same testing and then instead of using, I mean, I use blends of herbs anyway, but you can really dive into herbalism to be like a healing modality as part of your treatment plan.
Oh, awesome. Yeah, so with the testing that happens, like you're saying, you're not going to get the typical testing that you're going to get an allopathic pathway. You know, someone comes in, they are taking lisinopril or they're taking a furosemide and you're checking for their potassium levels, right? And looking and seeing, is this depleting this individual component from their body, or they're taking warfarin, you're looking at their INR, you know, something that's just kind of a very typical logical pathway to do for drug reviews and analysis. But in the functional medicine space, you're looking at more like root cause elements, you know, you're looking at microbiome, et cetera. And then you're deploying typically, Kristin, anything from like herbal treatments, but using a lot of supplements inside of that space as well.
Yeah, absolutely. That's my general approach is, you know, while we're trying to figure out what the root cause of things are, we also want to try to provide the patient with as much immediate relief as possible so they get those wins, right? And they gain trust in you and you're also helping them feel better. But the reality is that list of supplements can get really long, really fast. And patients can't sustain it financially. They can't sustain the pill burden on a daily basis. And so then they just give up and they go to another practitioner. So it's really a very delicate balance when you're doing these types of consultations, because you need to explain from the very beginning, listen, like this is what we're going to be working through. We're probably going to be on a couple supplements for a certain period of time, and then they're going to switch because we have to peel back the layers of the onion and heal in different phases. And so I definitely do use herbal blends. They're mostly in supplement form, but I would love to hear Marina's take on like some different things that she uses to help people get results.
Yeah, I think spinning it that way, Marina. So from your perspective, Marina, one thing we haven't talked about is really from the herbalism side, like when you're looking to choose an herb for an individual, what kind of lab testing and or point of care testing are you doing? I know it's a little bit different as you're telling me this morning, but how does your world collide with that space as of today?
Yeah, great question, Kevin. So as you know, herbalism is this ancient traditional way of observing really the world around us and the world within us. So it's kind of like drawing from the macrocosm down into the microcosm. And then we can break down our own body into microbiome, which is another universe on its own. So really, they didn't have the technology when they were doing these observations in the past to understand how things worked and what exactly was going on, but they really just matched what the observation was visually, and using the five senses as best that they could, which means we measure the pulse, for example. That's something we can touch and assess and count for, and we use a lot of visual observations because we didn't have traditionally the microscopes, the labs, or anything super invasive as far as like blood or urine analysis. But even physicians in the past would smell the urine and kind of assess the viscosity of blood and things like that. So they kind of knew how to observe the properties and the qualities of things, which is what I keep on mentioning over and over about herbalism. It's not like we can really go down into the nitty gritty because we're using those ancient systems, but still the patterns are really impressive with what they're able to discern without knowing, the molecular, what's going on in each atom and each molecule, and what the biochemistry is. So there is a lot of information that we could do just using our five senses, just being present with the person. So that's really where herbalism shines. And it's not invasive, right? So it's just like while you're talking to a person, you can really assess what they're like, what their energy is like, what their face looks like, what their skin looks like on their face, on their hands. If you're shaking their hand, you can tell what temperature, if it's cold and clammy, and all of those kind of cues that we can just kind of glean. And if a person's nervous, and if a person is sweating, and if a person's red or pale, or all of these like little signs that we can pick up on, that the physicians and herbalists of the past would really take notice of. And you can tell about a person's circulation by asking questions. And so I love the labs. I love that we have this in our new age toolkit, but we can also combine it with what cheap, free, accessible things that we relied on in the past, and we can combine the two, right? So that we don't always go for the test if we can avoid it, or if it does become like a financial burden on somebody. Yep. So I think if we use like all of these things via observational tools first, and then we understand, okay, do we need to do a stool test? Do we need to do any other functional or regular labs? And there is a lot of information in regular labs too before we even get to functional. So I feel like it's just a step-by-step approach, and it could be something that the patient and the practitioner decide together as far as like, what do we focus on first? Do we need a test right away? Or, do we do other things, upstream maybe to help with stress management, lifestyle, and all of those things, and herbs perhaps too. And so I just wanted to bring up that we have face diagnosis, we have tongue diagnosis, and we have pulse diagnosis. Those are kind of like the three things that herbalists will do. And now they are also learning about labs. Now that that's available, we are learning about that in herb schools, and there's special classes for herbalists that have been trained in herbalism to also be able to understand labs and be able to understand drugs, because people are coming to them on medications as well. So we have to kind of know everything nowadays, even if you're a holistic practitioner or if you're a mainstream conventional practitioner. I think it's a good idea to just be aware that there's these other methods out there and they can be combined. And, it's said that it's a diagnosis, but I just want to say, of course, we're not diagnosing people as herbalists. It is an assessment more so. And so you can tell a lot of information about a person and how they present. And of course, the pulse, you do have to be in person for that. And, there's no sort of permission or license that you have as an herbalist to touch people per se. So unless you're, like a massage therapist or another kind of practitioner, physical therapist that can touch people, you kind of have to also make it clear that is this allowed? Does the person feel comfortable with that? And maybe sign a consent form.
Well, that makes so much sense. I was just watching something last night. It was a it was like a new age doctor's visit. And I thought of both of you guys because when the individual came in, like they opened the door and everything was really like bright and airy, and they had a lot of technology everywhere with tablets and screens, et cetera, that you were touching. They had a biometric scan, like as soon as you walked in, and a body scanner. And then they had, genetic analysis and several other things along the way of the experience. And so the interesting thing to me is like what you guys are both saying. If I can come in to like the pharmacy of the future, and I am going to go in and I'm going to have what some people would call a physical assessment, which is really a exterior laboratory assessment from what Marina is doing, right? And have Kristin to be able to utilize CLIA waivers and everything else, that we would be able to have all of the testing necessary for me to get all that information in one foul swoop. I can't think of a better way to have truly personalized medicine than having all of those modalities come toward me. When you guys are thinking about like the pharmacy of the future and thinking about your guys' specialties and other specialties kind of being woven, what other things do you feel like are essential for us to make sure that we are having these worlds meet successfully for our patients? Kristin, I'll start with you on that one.
Yeah, it's a good question. And I really think that people, especially healthcare professionals, really need to be thinking about this, because I'm seeing, and this is just me, one little person in this, big world, that patients continue to come to me and tell me that they don't feel like their doctor is hearing what they're trying to say. They feel like they're being given solutions, but they don't want those solutions. And when they voice that, it's very uncomfortable for them to try to have that conversation and advocate for themselves. I just had a patient say that his optometrist, a very well-known optometrist and reputable doctor, said that there was nothing else that he could do about glaucoma. And it's like, it's unfortunately just not true. Like I understand that we go to school and our schools train us in a conventional way, but if we're repeatedly seeing patient after patient after patient asking us about supplements and herbs and alternative pathways to healing and prevention in general, then I feel like it's our duty as a healthcare practitioner to really start diving into a little bit more of that information instead of just writing that off. Oh no, there's no scientific research to prove that works, so don't even bother trying it. Like, we need to stop dismissing patients and open our minds a little bit more so that we truly can help the person that's sitting in front of us.
I love that. Marina, how about you? What are kind of the shifts that you'd like to see in the pharmacy setting of the future, or just in the medicinal healing, I guess, future of what we're trying to see as a practice and personalize it with weaving these things together?
Yeah. So number one, what I mentioned earlier, like communication between modalities, because it's impossible to be trained in everything and be the expert of everything. So we need to have people that are specialists in their field talk to each other and respect that, okay, if I don't have all the solutions, or the patient is, wanting another choice available to them or another option to consider, let's talk and let's recommend that they see somebody else. Let's refer out, or let's have like a meeting, with the modalities and the practitioners to just give that patient that choice, right? The option of understanding that it's their body and their health and they have a say. So that's number one. And then number two, for the pharmacy setting specifically, I feel like it's a great way to take care of those chronic or non-urgent matters and personalize a plan for a person that doesn't always have to be a prescription-based pharmaceutical. So I love, in other countries and even in our country, seeing that natural side of medicine in the pharmaceutical settings, whereas the urgent care in the hospitals, of course, we want them, to exist and to take care of people that urgently need it, but we want to keep as many people out of that setting, or to recur, consistently coming back as a revolving door. If they're coming in with an exacerbation of a chronic condition, we want to be taking care of those root causes. So that's where the pharmacy or other settings may be more appropriate and will relieve the burden of both the cost and the labor that it takes to take care of people that are very, very sick.
Wow. So for both of you, I think that when we go to any pharmacy setting today, we know that the accessibility of pharmacists and of practitioners is one of the highest levels, and you get asked a ton of questions. was asked a question. So I wasn't asked it. I guess I was overhearing it in a pharmacy the other day. And a patient came in and said, what do you have that is non-prescription for my headaches? Like, and in my mind, like in Kevin's little mind, like that's a very loaded question for me, especially being a hospital practitioner. I'm like, well, what's the headaches from? How long have you been having headaches, et cetera, et cetera. It's going off. It's all the triggers. And I'm like, I'm not the pharmacist. Just step back, Kevin, and let them do their job. So I didn't say anything, but I would have been so excited to be in that pharmacy and have both of you across the counter to be able to collaborate on like what you'd have taken for next steps. So let's just for fun, let's try it. So Kristin, I'm coming to the pharmacy and it's the Kristin and Marina team that are trying to help me out. And I'm saying, I am having brutal headaches and I want a more natural way to take care of it. I don't want to use ibuprofen. I don't want to use Tylenol. What should I do, or what should I think about?
I mean, the first thing that comes to mind for me are there food sensitivities? Like, without asking all the obvious questions that you like, that's what I would start doing naturally, is asking all these different questions to get more information. But instantly I'm wondering about food sensitivities. Gluten, dairy are the top two. And then magnesium, where majority of the population is deficient in magnesium, and there's a bunch of different formulations, and you need to know which one to use for what and how high you can take that dose to, because it is way higher than what we're traditionally taught of like 200 or 400 milligrams. So those would be my first kind of go-tos.
Any testing that you would do when they came in there?
I don't think there's really any point of care testing that I can think of off the top of my head. I didn't mention this earlier, but I do use regular blood work. There's a lot of stuff that you can find in regular blood work. But to be honest with you, between those two things, and like Marina was saying, to try to be less invasive and less costly, I would be surprised if we didn't improve. And then all the headache diary, right? So we want to monitor where we are to where we're going. But I would be shocked if one of those two things didn't at least reduce severity and frequency of the headaches.
So thankfully, these two sisters of mine love me enough to put up with my nerdiness, but I would have so been like, can I see your phone or your Fitbit or any of your trackable wearable technology so I can see how well you've been sleeping, what your rhythms have been of late, and be able to do some of that tracking. But so that's one thing I would have peeked at. And I love, Kristin, all the elements that you pulled in with, like going off of those major elements that could be causing it, trying to find the root cause, and then go toward where you would flow, I guess. Marina, what would you have added to the conversation with Kristin? How do you collaborated there?
Yeah, I mean, I think what you both brought up about first ruling out any potential emergency type of situations, just making sure that this is not a new onset, and have they gotten their MRI or other tests back? Do they have a diagnosis for this? How long it's been going on? And all of those questions first. And, just really direct them to follow up with the doctor and get those tests if they don't already have it, just to rule out serious conditions that might be happening. And number two is I would also just ask what does help, right? Does the ibuprofen help? Do they have a prescription that has helped? To also understand, like, is it a migraine type of headache? If they have been on anti-migraine medications, are they using anything preventatively? What are the triggers? And number one is we really do have to understand the health history a little bit more, because I really agree with what both of you said as like things that I would watch out for, or, common deficiencies to address. But also just asking those questions to know that we're giving them something that will serve them, and that we're not just throwing, everything possible that could be going on at them. So I also like B vitamins and electrolytes. I would ask them about caffeine intake as well, alcohol. And then if they are taking ibuprofen, like really trying to understand where is that inflammation coming from as well, which could be the food.
It's so true. I was really hoping you'd talk about, because knowing their medical history, like knowing what are the medications are they on, what are their treatments, I think those are pretty common for us as pharmacists to want to go, I want to know these to see if one of these is causing this or an interaction is causing this. The one thing I'm glad you touched on, which is one of Marina's like favorite herbs to be able to let people know this is an herb, is caffeine. Like caffeine utilization, how often are you using caffeine? When are you using caffeine during the day? And kind of getting into not only the things that are on the prescription profile, but all the things that aren't, which could be someone using supplements or herbs, in their overall regimen. So that's super helpful. The other kind of piece that was really curious to me, I guess, when looking at individual pharmacies and the way they're currently set up, I wanted to flip your guys' roles here. So let's say you are going into, this is just a fun exercise, no pressure, no grades. If you're going in, Kristin, and you're seeing a pharmacy and you're thinking this pharmacy is in a community that I know would leverage herbs inside of the space, how would you try to help that pharmacy to say, here's how you could start with an herbalism program?
Geez, that's such a good question. I think I would have to first assess the situation. And whenever I say that, I'm really talking about management, staffing, like what's the dynamic like in this pharmacy to begin with? Because if we're not even talking about like B vitamins or vitamin D, then bringing in a line of herbs, that might, it might be too much of a disconnect from what they're already practicing. So that's kind of where I would start, because I've worked in several different pharmacies where it's a good fit for the community, but there needs to be a lot of internal changes in order to really start having appropriate conversations with the customers, that where it's not coming off as just trying to sell another thing. So
I love that. I love one of the places that I'm connected with, one of my good buddies. He has an individual that is part of the community and is a pharmacist that wants to do more with herbalism. So he is a perfect individual, like you're saying, and I love that you pointed that out, Kristin. Is just because you see the need doesn't mean you can fulfill it unless you have the personnel that are capable of doing so, without it just looking like another product on the shelf that you're not going to be able to counsel toward, you're not going to be able to recommend toward. And I love seeing pharmacists that you can tell like what they're passionate about. You can almost see their foot tracks going toward that exact same product over and over again, because either one, it's worked for them previously, or they have a high knowledge base on it. And so you get higher turns on that individual inventory, and you get more benefit for the patient, because then they have an in-depth understanding of how can this benefit and how can it not. Okay, Marina, now flipping the table on you. Let's say that you're going into a pharmacy and they don't have any point of care testing. They don't have any laboratory services like inside of their space. How would you evaluate them, I guess, overall, and how would you want to implement, some of those tests inside of this pharmacy?
Yes. I think I would do like a similar assessment, just to find out how they're already serving the community and what are the gaps potentially, and are they interested and motivated to fill those gaps? Do they have any sort of market research to find out what the community would need or would respond to? Because we also don't want to offer a service where it turns out nobody is looking for that. So if there is, all of those things align and there's interest and they're interested, then I would start maybe encouraging them to network with local providers and start to kind of market the fact that they're going to be offering these things, and really just implement probably a stepwise approach as to what could be like the simplest, most non-invasive tests and assessments that we can bring in. And then how do we start building on top of that as hopefully interest grows?
I love it. No, that's absolutely fantastic. I think the best idea is probably to have the folks interested in herbalism just referring them over to Marina, and the folks interested in testing referring them to Kristin, and just letting them rock it from there. Okay, so the last couple minutes, I wanted to give you guys a sec to ask each other a question. We'll start with Marina. Do you have a question for Kristin?
Well, I just want to get to know you better and find out how this is working for you in your setting. Are you a pharmacy owner? And, how long have you been doing this?
Yeah, no, I actually want to get to know you better as well and see how you're kind of using everything. But I'm not a pharmacy owner. I have an integrative wellness practice is what I call it. So I'm the only practitioner there, but I do see people for integrative wellness consultations, and then starting to get into the community to do like these group programs. So right now I'm in the middle of delivering a diabetes prevention program, where I'm kind of weaving in some of these, integrative practices, and because people are looking for answers, and they're actually really loving it, and they're open to more alternative practices. People are sick of the only solution feeling like another prescription or another surgery. So anyway, in those group settings, I'm starting to kind of tie in point of care testing with that, with regard to like chronic disease state management, if people, if that's a gap in their care. So that's what I'm doing right now.
Well, I love it. Well, we will definitely continue the conversation. I know we're running up on time here. Thank you, Marina. Thank you, Kristin, so much for coming together. This is too much fun. And we'll definitely do it again. Everybody, if you can, join rphally.com. Make sure you join Kristin's channel with lab services and point of care testing, and Marina's Herbalism channel to get even more information. And we will see you guys next week.
Bye-bye.